With respect to the U.S.-Canada border, what I would say is that we continue, obviously, to look at the epidemiology of COVID-19, both in the United States and also here in Canada. And I would say at the present time, I think people can appreciate that they are vastly different. Here in Canada, I think we've done a good job of, as they say, flattening the curve. We have an average about 300 cases per day in Canada. I think in the U.S., quite a bit more, 60,000 plus cases are reported every day. Certainly, myself, from a strictly public health perspective, we recognize that the priority in many ways is to protect the health and safety of Canadians. Canadians have made tremendous sacrifices to date in terms of flattening the curve, and we're seeing the fruits of our labors, to be quite honest. And I think we're very mindful that we don't want to, quote, waste those efforts by potentially, quote, reintroducing the virus into Canada and increasing the risk of further transmission. So therefore, it's important that we look at what's happening in the United States and continue to monitor. We recognize, of course, and I can only speak as a public health expert, that there's so many important aspects to consider in terms of the U.S.-Canadian relationship, economic, social, and otherwise. But from a strictly public health perspective, certainly the measures we've taken to date, I think, are reasonable. And certainly myself, Dr. Tam, and others, we will continue to give this government our best advice based on the public health perspective in terms of the evidence and the data we have to date.